You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. According to my first guest, Dr. Eck, he says that you're never too far gone. Your teeth are never too bad. Your gums are never too bad to have the smile you've always wanted. With us, and we've had him on the program before, Dr. Fred Eck. Dr. Eck, welcome to the program.
Thank you for having me again.
Now, for people that don't know what full mouth reconstruction means, I guess that's a dental term you guys use?
That's what, yeah.
I called it extreme smile makeover. So what is it? Like, what's a full mouth reconstruction?
It's somebody comes in, they haven't been in a long time, and their teeth are broken down. They could have cavities, they could have, side effects from medications, they could have dental phobia, and they just don't show up for 20 years, and they have severe dental problems. Reconstruction is essentially restoring your mouth back to what it used to be.
Okay, good. Now, you have a team of 9 dentists that you work with, and you kind of do everything. Like, you have this center where it's kind of all under one roof. Tell me about that, because you do a lot of things.
Yeah, well, both of our locations are set up to be multi-specialty centers, so anything you need, we can do under one location. So you don't have to go from office to office to office. So for you, that's an advantage because you have the doctors working on your case in the same office, talking to each other. It makes things more predictable and saves money to not have to go to multiple facilities. And we can do anything you want under one roof.
Now, so everybody's kind of trained the same way? All the dentists?
Everybody has training to do what they do. So we have people that do periodontal, we have people that do oral surgery, we have people that do nothing but implants, we have people that do nothing but basic restorative and cosmetics, crowns, bridges, veneers, etc. But so when a case comes in, the appropriate doctors are brought together and think as two heads at one time. Okay. From all different aspects, not just somebody with their particular vision and their particular education. You get other eyes. 4 eyes are better than 2, and 6 eyes.
And it doesn't cost more to do it that way?
It does not.
Okay.
And in fact, it probably saves you money because you don't get into the middle of it and say, man, I missed that. Wish I would have got that. And now you're making steps backwards in order to go forward again.
Now, nobody likes going to the dentist, right? Especially when they have a lot of work that needs to be done. You're big on sedation dentistry.
Yeah, well, the reason why they need all the dentistry they need usually is because they haven't been in a long time. Dental phobia, I'm told all the time, is typically and usually the #2 phobia. Right? We come above death. People are more afraid of dentists than dying. Okay, so it's a very common.
Do you hear
phobia.
that where they say, "Hey, no offense, Dr. Eck, but I don't like the dentist"?
Every day. I
mean,
I could be out at a restaurant and say, "No offense, but I just can't talk about you guys," and it just happened not long ago.
So if you're at a party and you say you're a dentist, it's like, oh boy.
Yeah, I don't normally introduce myself as a dentist at a party or anything because people are that phobic, they shut down.
So sedation, tell me, I interrupted about the sedation. So who's getting sedation these days?
Oh, everybody. It's very common. We offer all levels of sedation. We do anything from nitrous gas, oral sedation, IV sedation. We have people that come in, and by the way, the definition of a phobia is as an irrational fear, okay? So you don't take somebody, if somebody is apprehensive, you can give them a little nitrous, you can pat them on the back, just go really slow and get them through the process, right? But if somebody's a phobic, that's defined as an irrational fear. You don't walk them through something. If you're phobic of an elevator, guess what? You don't get on one.
Yeah.
Period.
Okay.
If you're phobic of dogs, you don't get around them. Okay. If you're phobic of dentists, you don't go. Okay. And so people will only go to it that are phobic will only go to the dentist that they know does sedation.
Or when they're absolutely in pain, right?
Right.
Don't men put everything off?
Everybody puts everything off if they're phobic.
You wait until you're in pain.
Right, and now, once people come through and have a great experience and realize the sedation works for them, we have people that literally come in and get their teeth cleaned under sedation.
Like nitrous or something?
No, sedation, IV sedation, because they cannot sit in a dental chair, okay?
And they almost don't remember the procedure? I haven't had IV sedation
They
before.
don't usually remember any of it, yeah.
Is that right?
Yeah. We've even had people come in for Invisalign impressions that had to have IV sedation in order to get an impression because they can't sit in a dental chair knowing anything that's going to be done without sedation.
So this full mouth reconstruction, that means this is a person with a broken down mouth, bleeding gums, bad breath, bad bite issues as you like to talk about, and their teeth are, falling out, right? Extraction here and there, and then it's your role to kind of clean them up.
And you put it back together.
And you do it all right there. So, and you have specialists in your practice, is that right?
Yeah, we have an oral surgeon, MD, we have periodontist, we have restorative doctors.
So sedation, people that normally wouldn't get things done are getting it done.
Absolutely.
Now, you know, I don't know if I told you, in fact, he runs one of the largest companies in the world. He was being interviewed on the news. And all I could see was after talking to you, all of his rotted lower teeth. This is a guy that's a multi-billionaire, but he does nothing. Do you think it's really the fear or the hassle of the dentist?
It's one of two things. People that are very busy and very wealthy, they travel a lot, and time is a big issue for them. But the number one reason is phobia. You know, we have a gentleman we saw about 6 months ago. He comes in, similar story. He's got all the money in the world. You wonder how he gets in this shape, you know. But it became very clear as soon as he got into the chair why, and it was phobia. And he just hated to be at the dentist, hated everything about it. And it's great because when these people go through, and John went through a full mouth reconstruction, you know, and now has a beautiful smile, his whole demeanor changes. When he walks into the office now, he comes in, says hi to the girls, comes in just to say hi, you know.
Is that right?
And smiling, is telling us, listen, I quit traveling, I quit going out, I quit doing everything because of this. Now I'm back to, and he's in his 70s. And he's like, I'm back to life again. I've been like this for 25 years.
Are there a lot of people that don't like their smile, like hate their smile, hate their teeth?
There's a lot of people, and
Really?
it has a big impact. You know, there's many studies been done about the impact of your smile, you know, on your body and health. You know, there was a study in Munich where they took people and did what's called a functional MRI, where they look at that area of the brain that deals with emotion and everything. And then it's the same brain that gets excited when you have like the chocolate that you love, right? It just makes you happy, right? And they did Botox on these people. Botox paralyzes the muscles. So they did Botox in the muscles that would make you smile. They couldn't smile. And it actually had an impact on the circuitry in the brain that deals with emotion when they couldn't smile.
So when you're smiling, you're happier.
You're happier, you're healthier. There was a study done, UC Berkeley did a study years ago, 30-year longitudinal, a long study, where they took people and looked at yearbook pictures and then followed, and they were able to predict over the years, based on their smile and width of their smile, how well they would do in marriage.
Really?
Okay, how well they do on standardized tests. Okay, how they would do general happiness in their life. I mean, your smile has a tremendous impact on you.
Smile makes you more successful,
Makes you more successful, yeah.
Well,
And
you're a dentist. Now, of course, you're going to say that. You probably think it's the most important thing.
That's not me saying it. There are many studies saying this.
Okay.
I just see it day in and day out. So, you know, you take two twins and put them in a job interview, and they have the same qualifications. Everything else is the same, and they look the same, and one lets her smile go. Who gets the job? If all else is the same, who gets the job? It makes a tremendous
So one
difference.
is smiling, one isn't smiling.
Correct.
You'd probably hire the one that looks positive and happy and well-adjusted and self-confident.
Yeah, always. And then, you know, I had a patient years ago who came in, and he came in, and I said, Earl, what brings you in now? Because he's had a bad smile for a long time, and he just didn't value it that much. And then he said, I'm at a point that I don't go out to restaurants, I don't go out to eat. My wife's not happy. I can't eat what I want, so I don't go out to eat, and my wife wants to go eat. So Earl had an upper denture he couldn't function with. Okay, he had it for over 10 years, couldn't function with it. His lower teeth, a lot of loose teeth, had some periodontal issues, had a couple missing teeth. So for him, we saved his lower teeth, did some bridge work, did some laser work, and on his upper, we did an implant reconstruction on the upper, and gave him teeth that were solid, wouldn't move around, and he could chew what he wanted. He came in weeks later for his first post-op appointment and told us how he went home and went to the grocery store and bought the cheapest steak he could buy because he didn't believe me when I said, you'll be able to eat what you want. And he said, I ate it, it was fantastic. And he goes, now my wife is so happy because I will now go out to restaurants and do everything she wants to do. So it has an impact not on just their life, but the surrounding
What do
family.
they like more? Do they like the appearance of the new smile, the new teeth, or do they like what they could eat and chew?
For John earlier, it was about the smile. It was all about the smile. He walks in, smiling. He doesn't stop smiling, For Earl, it was the function. that he could actually go do what he wanted to do and look normal, like smile and eat foods normal and not worry about what he was eating.
So what if you have like really bad gums? Can you still get like a full mouth reconstruction?
You can.
Like veneers, things like that, even with really bad gums?
Absolutely. The good news is, in our office, we do all the procedures. So gum treatment and laser gum treatment, which is very simple to do, very easy to get rid of the gums problems and have healthy gums. You just do that first, and then you can do whatever reconstruction, implants, whatever you want to do, because at that point, the gums are healthy, there's no bacteria, and you're set up to do whatever you want to do.
So take me through the process. Somebody goes to your practice, and we're talking about full mouth reconstruction. According to Dr. Eck, no matter how bad your teeth are, there's hope, right?
There's always hope.
Okay, so somebody goes in, bleeding gums, teeth are loose, they're flaring, they're losing teeth. They go in. What's that first appointment like?
The first appointment, it's all about the diagnostics. First step is getting to know your desires. What do you want? Because if we don't have a roadmap, if I don't know what you want as an end result, then we may end up with the wrong result.
Don't they all want the same thing, like eat and chew and a good-looking smile?
Yeah, but everybody's different in what they want. Some people want to save their teeth and keep them no matter what it takes. Other people are tired of the teeth. They want them out and they want to do implants. Some people want really big teeth, and some people don't want to show their teeth when they smile much. So everybody has their thing that they want. So, we had a gentleman come in several months ago, and he's tired or done with his teeth. He came in, he wants to know if it's worth saving his teeth. One of the things that we do in our office is we get a lot of diagnostics done. So we'll do a saliva test and determine what kind of bacteria you have, how much of an impact is this having on your system, to help us decide, is it better to save your teeth or should we take them out?
So they literally come to you to save their teeth?
Yes.
Okay.
And so we'll do, Francis, for instance, came in and he says, listen, I want to save my teeth if it's predictable. I don't like to go to the doctor. I don't want to do something in 10 years down the road, be starting over. So getting to know the patient and what they want as that end stage is important. He wants his final thing to be predictable. Okay. So we do on him what we do on a lot of these patients to make decisions on predictability is we do an oral saliva test. Okay. And one of the things that does is it gives us a bacterial profile. And so if we look at his bacterial profile,
all right,
there's 11 different bacteria that could create periodontal disease. He's positive for 10 out of the 11.
Of the 10 or 11 bacteria?
He's 10 out of the 11.
Okay.
He has them all. Not only does he have them all, the levels at which he has them are all way greater than they should ever exist.
And that's what's causing him to lose his teeth?
And that's what's causing his problems.
Okay.
Okay. So when I look at that, in combination of his interleukin-6, which is how your body turns over bone, it's something that we have to take into account as to how well they'll respond to treatment, okay?
All right.
Here's the other thing we get when we do these tests. We get their A1C, which is a diabetes screening, right? His A1C comes out to be 6, which puts him in that pre-diabetic, that insulin-resistant level, right? And I hear patients all the time say, I'm pre-diabetic, my doctor has me keeping an eye on it. That's crazy. Okay? Because, first of all, if you're insulin resistant, you're 3 times greater chance of having a heart attack or a stroke. Okay? So, if you're insulin resistant or pre-diabetic, it's reversible. Okay? Through diet, through medication, it's reversible. If you go to the next level, because when you're insulin resistant or pre-diabetic, it's usually not if for most people, it's when you become diabetic. Once you become diabetic, it's not reversible. At this stage, it's reversible. But it also tells us the fact that he is pre-diabetic, it still impacts how he heals, right? So can I go through and save all of his teeth? I can. But remember what he said up front, predictable. I don't want to be 10 years starting over, 15 years starting over. So for him, based on these tests, he's better to take out his teeth and do an implant reconstruction. Okay. If he didn't have that level of bacteria, okay, and if he wasn't pre-diabetic, and I knew that his periodontal treatment would last a long time, because if I do his periodontal treatment and he spends money on periodontal treatment, and in 6 years, 8 years, he's doing it again, and in 12 years or 15 years, he's losing his teeth, he's not going to be happy, because he told me up front he wants to be done.
Okay.
Right? So we have to listen to the patient.
So the testing, is this always done? Is this rare? I don't hear about this, by the way, and I've interviewed a lot of dentists.
It's not rare for us. We do this on most of our patients because it allows us we have patients that fly in from everywhere. We have to do stuff, and that's the thing with this gentleman. He travels. He doesn't want to have to come in all the time. He doesn't want 18 appointments, you know. So we have implant reconstructions that we can do where we can take out your teeth and in 48 hours give you your permanent teeth. Your permanent teeth, not temporary. You're going to hold.
Smile.
Great smile. But not temporary, you're going to hold for 6 months and then do your permanent teeth in 48 hours, which is what he wanted. He wanted to be in, out, done, predictable, not worrying about what was going to go on 10 years down the road.
Everybody wants it done fast these days.
Yes, they do.
So they're never left without teeth.
No. No, you can always have teeth.
And most of these people, when they go to you, like some people need a single tooth implant, or some people need crown and bridge, or some veneers. You're doing all of that. I mean, you offer all the different, and Invisalign.
You know, we do all, not only all the different treatments, we do all levels of treatment. You know how many dozens and dozens of phone calls we get a day. How much is an implant? How much is a crown? That's like calling a car dealership and asking how much is a car.
Okay.
What do you want?
Right.
What options do you want? Because there are over 1,000 implants on the market.
Okay.
They're not all the same. Okay. There are over 70, 75 crowns, types of crowns on the market. They're not all the same. You know, it's like people seem to understand that a $40 DVD player is not the same as a $300 DVD player.
Okay.
But they'll call around and say, how much is the crown? And they think somebody answers the phone and says $700, and this guy says $1,400. They think they're getting the $1,400 crown for $700. That's not what's happening. You're getting a $700 crown. That's the way it works.
So one just may last longer than the other.
Lasts longer, looks better.
Material.
One of the biggest advantages of the higher end crowns, okay? And for most people, the most expensive option is not normally what's best, okay? Something in the middle, the best value thing is what's right for most people. And today we have crowns that we can do that we can take away so little tooth structure compared to the old, like 3 times less than the old style crowns. And they look fantastic.
Now you pride yourself, we talked on the phone, like you pride yourself in affordable dentistry. That you're not all about, because you say the newest trend, and I'm not putting words in your mouth, but you said the newest trend in dentistry is just, if it's an infected tooth, pull it out and put in an implant. You don't necessarily agree with that.
Well, no, if you can save a tooth.
But that's going on, you say?
No, that's a big part of the marketplace now. Take out a tooth, put an implant in. But if you take out a tooth because it's loose, how much bones are remaining around the tooth? Not a lot, right? That's why it's loose. That's why it's failing. Well, if you can save the tooth, do some laser and save the tooth, it's going to be easier and cheaper than taking it out and doing the implant, right? Because if it's savable. If it's not savable, then don't try to be heroic and do something that's not going to last. But if it's savable, that's going to be easier and cheaper. Because think about it. If you take out the tooth, you don't have bone. Now you got to do bone grafting, which costs more than the implant does.
Okay.
So if it can be saved predictably, then that's usually your best solution. Mother Nature's option is usually better than the replacements.
Now, your practice, so if somebody needs a root canal, they normally would go to an endodontist, but you are doing your root canals there. Is that right?
Yeah, we have 3 doctors that do root canals. We have 4 doctors that do implants. We have doctors that do everything.
So you're doing it all right there.
Yep.
Now, the transformations. You say that you'll take somebody with the worst teeth, or what they think is the worst. They'll say, Doc, I bet this is the worst you've ever seen. Now they get a new smile, and their life changes.
Yes.
Really?
Every day. And usually when they come in and say, this is the worst you've ever seen, it's almost never the worst we've ever seen. It's most people's cases are, for us, we do this every day. So for us, what might be complicated for a lot of people is pretty simple for us.
So these people with really bad teeth that say, this is the worst you've ever seen, well, they say that probably because they never see it. Like I've seen some of your before and after photos. I've never seen people with such bad teeth. Yeah. And as you pointed out, because they never smile.
They never smile.
They're walking around Florida not smiling.
These people, they don't go out in public. They don't go to the dentist. They're afraid. They're phobic. So, most offices don't see them. We see them because we offer sedation. So they search out an office where they can have sedation.
You think people are judged based on how bad their teeth are?
Oh, absolutely. In all aspects. There's even been studies done not only about the smile and its impact, but also orthodontically and jaw alignment. They've done studies where people actually judge people's intelligence. They've had showed people pictures, and based on their jaw alignment and their cosmetics, and if their lower jaw is shorter, they always score less intelligent.
Mm-hmm.
by somebody that doesn't know them, just doing ratings.
So if you have really bad teeth, like in the movies, right, in Hollywood, if you're going to try to make somebody look poor, what do? You give them bad teeth.
Bad teeth, yeah.
Make somebody look dumb, you remove their front tooth. It's just, it's standard.
Yep.
So now, when they look at so they do an extreme smile makeover, this full mouth reconstruction, and they look at their mirror for the first time. What's that like?
Well, it's for most people, even men, many men will cry. It's just something they never thought they'd see again.
Now, with these extreme smile makeovers, so somebody could come in with bad gums, bad teeth, missing teeth, and because of sedation, you can get it done in one day. Why? Because they could be in the chair that much longer?
Because they'll be in the chair that long.
Like you could do 6 months worth of dentistry in one shot.
It's an awful experience for anybody to sit in the chair for 5-6 hours, okay? But if you're sedated, it could be 5 minutes or 6 hours. You don't know the difference.
Is it safe?
And you don't remember it usually.
What about the safety with sedation?
Oh, it's absolutely safe.
You just need what? A special certificate to do sedation?
Yeah, so
because very few,
doctors,
not all dentists, general dentists do sedation, IV sedation.
Well, right? This is another reason. This is another reason why people go untreated and why people lose teeth. Okay, most surgeons, because they're doing surgery, are certified to do sedation, right?
Okay.
So you're going to take out a wisdom tooth or a bad tooth, or going to have some gum surgery, right? A lot of surgeons do sedation because of the nature of the procedure that they're doing. But people who want regular cleanings, people that just want a crown, people that want some cosmetics done,
yeah.
Okay, they wait until this tooth hurts. Today, it might need a root canal and a crown. It's easily saved, but because so few restorative doctors do IV sedation, they didn't find somebody to do that, so they're afraid, so they wait till it bothers them enough, and then they go to the oral surgeon. Why? Because of the sedation. And what's your option? Take out the tooth, right? So a tooth that could have been saved, but they couldn't find a restorative doctor that did sedation. So that's fantastic. We can provide sedation, and anything you want to have done can be done.
So they're numbed up. Then they get an IV sedation or nitrous or a pill. Is that right?
Yeah,
and
there's all 3 levels of sedation.
Is it true that sometimes you could do a huge procedures, complete makeovers in the mouth, and they don't even remember it?
Most of the time, when they're sedated, they don't remember. It's one of the blessings of the sedation meds. It's got that amnesic effect for a period of time, and you normally don't remember.
Now, I have doctors, dentists, that will tell me, they say, Randy, look, if you have the right bedside manner, if your patients like you, you can calm them naturally. You don't need sedation. Do you think that's insensitive of them to say that?
One, is insensitive because you're taking somebody who needs something and forcing them through a situation that they don't really want to go through.
Being there, even for a cleaning with your mouth open, is I don't have any phobia, but I'd rather, when I did nitrous for the first time, it's like a day at the spa.
Yeah, so people who are anxious, again, it comes back to that definition of a phobia, the irrational fear. If somebody's anxious, you can walk them through it. You can play music. You can, and we even designed one of our waiting rooms to look like a spa to help with the anxiety. Okay. So the anxiety patient, this works on. You do nitrous, and if you've never had nitrous, you do nitrous. It's very relaxing, right? But if you have a true phobic patient, you're not walking them through anything. They have to be sedated. If you try to put
But you've heard that before,
through,
like other dentists tell you, well, I could do it without sedation.
When we hire a new doctor who hasn't done sedation, they'll sometimes make that mistake, okay? Well, they say they're coming in for sedation, but I think I can get them through it, right? And we got to teach them immediately. No, don't do that, because you got a patient coming in here because we do sedation. That's like somebody coming in saying, I want to save my teeth, and you say, let's take out your teeth. No, that's not what they came here for. If they came here for sedation, you give them sedation.
Okay. And there's a lot of people, I guess, once they do sedation, they want it done on everything.
On everything.
Like cleanings, whatever.
Anything. People will come in and do
I mean, from
everything.
a business standpoint, it's good because people are no longer afraid to go to your office.
Right, you can get them coming
It's
back.
like not a hassle.
Right. If you're set up, most offices aren't set up to do sedation other than for maybe surgical procedures. We have rooms set up to do sedation for anything.
So normally, okay, so if you have gum disease, you treat that with your laser.
With the laser. Yeah.
With the bleeding gums, the bad breath, loose teeth. You do cosmetic crowns, bridges, veneers.
Yes.
You guys do all that right there.
We do it all right there.
Orthodontics.
Orthodontics we do.
You do that
Invisalign we do. Every implant option that's out there we do. You know, that's one of the advantages of having a larger office. You know, most offices, they have you know, you asked me a question earlier about the procedures that we do, and it's not only all the different procedures that we do, but it's the different levels, as I talked about before. You have somebody that comes in who can't afford this. Well, there's this and this on the market, and in our office, we have all those available. We have 15 different labs we use. Okay,
so you give people like the low end, less expensive option, medium, and then you know.
For most people, it's something in the middle that's best for them. There are always higher end, there are always lower. Most offices can't do that. You got 1 or 2 doctors, and they got their 1 or 2 labs that they use, and between that doctor and that 1 or 2 labs, they have their procedure or 2 that they like to do, that lab provides, and that's what they do. So when you come in, that's your option. For us, we can give you whatever you want. We got 15 labs. So with all these labs that we can utilize, you know, we're known for the affordable kind of have something for everybody. It doesn't really matter what your budget is or what your desires are. We have a doctor and a lab combination that can provide you with whatever you want.
Okay, so if you don't like your smile, do something about it. Is that your
Absolutely.
message?
There's no reason to not to.
Don't wait.
And it's affordable. You know, people finance their. You know, why are there tens of millions of cars sold? Because people could pay $200-300 a month, right? Nobody goes out and pays $30,000 for a car. Nobody pays $20,000 for a car. Everybody, anything in this country, anything that costs more than $1,000 is financed 90% of the time. Dentistry is no different. People that come in and do that, they pay $200 a month, and they go.
Do you take insurance at all?
We do take insurance. We have people in our office that is their sole job is to make sure you maximize your benefits. When you come in, they call code by code. They find out exactly what your insurance coverage is, and they'll be able to maximize and get whatever your insurance to reduce your out-of-pocket costs.
So change your smile, you can change your life. You believe that?
Absolutely.
I mean, you've seen like huge people start new businesses, people get married, people become more outgoing, all because of their teeth.
Yeah.
Now, you've written a book on what we're talking about today, right? You're a best-selling author.
Right.
Wrote a book about dentistry. Tell me about that.
What I did was I contributed a chapter to one of Brian Tracy's books called Change Agents. And what I talk about in that book, and it was a #1 selling book best-selling book in 48 hours when it hit the shelves. And what I talk about in that book is this whole difference in the different options and why we utilize as many labs as we have so that pretty much anybody that comes in can be treated.
In an affordable way.
In an affordable way.
Okay, good. I want to thank you for coming on the show. Good stuff. So, you don't like your smile? Give you a call, free consultation.
Yes, come in for a consultation. We can actually, at this point, with everything we can do now with digitally, we can actually do a digital workup and show you what your smile would look like. We don't charge for consults. We don't charge for the virtual mock-up to see what your options are. If they go to our website, bonitadentalcare.com or marcodentalcare.com.
You guys are busy. I mean, you're one of the busiest in Florida.
We're very busy. We saw almost 30,000 appointments last year. We're very busy.
All right, good. I want to thank you for coming on the show. Good stuff.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.